Welcome to the Community Health Centers of Southern Iowa story. The mission statement guides the Community Health Center in everything it does. The mission of the Community Health Centers of Southern Iowa is to deliver accessible and high-quality primary and preventative health and behavioral care in the Southern Iowa region to everyone in need. In 1997, Dr. Pat Magley, Jim McKinney, Chief Financial Officer at Graceland University, and Bonnie Orris, a local pharmacist, met for the first of several meetings at the Pizza Shack in Lamoni to discuss how to improve health care in Decatur County. Out of these meetings, the Steering Committee of Concerned Citizens established Healthcare Development of Lamoni, which later became the Community Health Centers of Southern Iowa. This group's concern for escalating healthcare disparities and decreased access to affordable quality healthcare led it to seek federal funding. After several attempts, the Community Health Centers of Southern Iowa received a federal grant of $650,000 in December 2004 for this purpose. The Community Health Centers of Southern Iowa opened its doors to patients April 1, 2005 in Leon, Iowa, followed by a second clinic site in Lamoni, Iowa, which opened on June 1, 2005. The health centers offer medical services at the Lamoni and Leon sites. These services are for all ages and sexes and include women and children examinations, screenings, preventative examinations, and immunizations. On July 1, 2005, the behavioral unit of the Decatur County Hospital transitioned to the Community Health Centers of Southern Iowa as the Behavioral Health Centers of Southern Iowa. Therapy at the Behavioral Health Centers is offered to clients of all ages who need assistance in dealing with depression, anxiety, hyperactivity, behavioral problems, family conflicts, losses, adjustment difficulties, and other behavioral health issues. The health center is the community's only combined medical and behavioral health practice. This combination allows patients to be diagnosed and treated in a truly integrated manner. The service area includes the counties of Union, Clark, Lucas, Ringgold, Decatur, and Wayne in southern Iowa, and Harrison and Mercer counties in northern Missouri. In addition, behavioral care services in Monroe and Appanoose counties are offered by agreement with River Hills Community Health Center in Ottumwa, Iowa. These counties, all rural, represent the poorest counties in their states, with Decatur County being the poorest in Iowa. 8 of the 10 are designated as medically underserved, in many cases for primary, dental, and mental health care. The Community Health Centers of Southern Iowa has practice sites throughout its service area. In Albia, in Centerville, in Sheridan, in Corydon, in Lamoni, in Leon, and in Monair. Clients without health insurance can participate in the sliding fee schedule, which offers services for as little as $10 a visit. The Community Health Centers of Southern Iowa believes that quality health care should be available to everyone who needs it. No one will ever be denied services because of an inability to pay. Patients have the advantage of a low-cost drug program called 340B that greatly reduces the cost of drugs. 340B is a federal program designed to provide low-cost prescription to patients of community health centers across America. Through this government-sponsored program, the Community Health Centers of Southern Iowa can purchase prescription drugs at a greatly reduced price and pass the savings on to its patients. A board of directors governs the Community Health Centers of Southern Iowa. The board has full authority and responsibility to oversee programs and policies. A majority of the board's members represent patients and clients of the center's services. The governing board defines and preserves the health center's mission, sets policies, approves the budget, protects the assets of the organization, selects and evaluates the chief executive officer, monitors the center's financial stability and quality of service, and creates a strategic plan through vision. Gary Reese was appointed Chief Executive Officer in January 2005. Reese has been involved in healthcare in various managerial and administrative positions since the mid-70s. He has master's degrees in counseling and health facilities management. John Dunston serves as Chief Financial Officer and Chief Operating Officer. Beginning his employment in January 2005, Dunston comes to the community health centers from Graceland University, where he served as Assistant Director of Financial Services. Dunston, a CPA, brings with him a vast financial background, including 12 years ownership of a public accounting firm. He has a BA degree in Business Administration and a Master's in Business Administration. Dr. Patricia Magley is the center's medical director and physician. Dr. Magley has a true commitment to healthcare and her patients. For over 20 years, Dr. Magley has practiced in Decatur County in various capacities and has given her time generously for many healthcare-related volunteer activities. Jody Hill is the clinical director on the medical side. She has a Bachelor of Science degree in nursing and has experience in acute care in hospitals and physician practices. Hill joined the community health centers in March 2005. Dave Hook is the Chief Operating Officer of the Behavioral Health Centers of Southern Iowa. He has a master's degree in counseling and is a licensed mental health therapist. Hook has an extensive background in behavioral management and therapy. Mark Hensley is the Medical Director of the Behavioral Health Centers of Southern Iowa. Hensley is a board-certified advanced registered nurse practitioner with emphasis in psychiatry. The Community Health Centers of Southern Iowa believes in putting patients first. The Community Health Center believes in quality improvement and performance management. The Community Health Centers believes in empowering the workforce, and the Community Health Centers believes that all of us is better than one of us.